A very good morning, respected chairpersons and judges.
Can
So
you
I'll
speak
be,
loudly?
yeah, am I audible? A very good
Can you speak
morning,
loudly?
respected chairpersons and
Yeah.
judges. I'll be presenting a case report on Ayurvedic topical medication induced bilateral toxic endothelitis. So we know use of unprescribed Ayurvedic topical medication is a very common practice in India, and it is a major public health problem. Toxic endothelitis has been reported by back, riboflavin, amantadine. But there's a huge lack or lacunae in the ocular side effects of traditional medicine and their use. So we report a case to highlight this condition. So a female of 51-year-old presented with bilateral right eye more than left eye, sudden onset, painful diminution of vision associated with foreign body sensation and watering. It was not associated with any photophobia, history of trauma, HSP, keratitis, previous episode, similar episode in the past, any ocular surgery or any other significant systemic disease. On a lot of coxing, she gave a history that she used over-the-counter topical Ayurvedic medication since 1 week prior to the onset of the symptoms. So here are the ocular examinations. So both eyes was 660. Little magnexa was within normal limit. There was no foreign body. It was reverted to check. The conjunctiva, minimal congestion was there. There was no foreign body. So now coming to the cornea, the epithelium was intact. There was mild stromal edema. There were descent membrane folds, as you can see, and fine capies. The corneal sensations were intact in all quadrant. Anterior chamber reaction was 1 plus and mild flare was there. Rest of the examination was normal. Although on fundus examination and our VR checkup, there was the FR was dull, foveal reflex was dull. So the OCT was done and there was an ERM existing in that. IOP was within normal range. So we went ahead with the specular microscopy. Because of the corneal edema, the counts were not very clear, but both eyes had pleomorphism and polymagnetism and a little bit decreased view due to corneal edema. Central corneal thickness was 590 in the right eye and 578 in the left eye. So we made a diagnosis of drug-induced acute toxic bilateral endothelitis. Treatment was started. The causative drug, as the patient was still using it, was stopped. Topical steroids, fluoromethalons, 6 times weekly taper was started, along with an antibiotic to prevent superadded infection. Lubricants were started, and sodium chloride 5%, eye drop 4 times, and sodium chloride eye ointment 6% was given at night as hypertonic agents. So on follow-up, first week, the vision improved to 612 in right eye and 69 in left eye. At 2 months, 69 in right eye. But it was because of the pre-existing ERM that it did not clear to 66 as it cleared in left eye 66. And there was a complete resolution of bilateral corneal edema. At 1 year, the patient maintained her vision, BCV of 69 in right eye and left eye 66, with no recurrence of symptoms. And we can see the specular microscope with normal cell density and morphology. And even today, present at 3 years, the patient maintains her vision and her specular findings. So the causative agent, I'm not naming the drug right now, but it had a lot of onion juice, ginger juice, citrus lemon juice. The pH was 1.5, which was acidic. The ocular effect of above agents have not been documented in the literature, but we know that these traditional medicines do have an effect on the endothelium, and there's a lot of lacunae in the case reports. So to discuss, the corneal edema is based on few mechanisms. It can be either due to corneal epithelium damage, raised intraocular pressure, endothelial dysfunction, or idiopathic, which is without epithelium compromise. So in our case, there was no epithelium compromise. IOP was normal. So we contributed that there was a significant positive history of use of a toxic medication. We conclude drug toxicity as the cause of acute endothelial dysfunction in our case. So, to conclude, use of unprescribed traditional Ayurvedic topical medication consisting of plant and animal material in aqueous media is a very common practice in India, and we do deal very regularly in our practice. So, this just highlight the side effects of traditional topical medication and need of urgent medical care. These are the references. Thanks to my co-authors. Thank you very much.
Thank you, Dr. Aditi.
Thank
It
you,
was a
ma'am.
nice presentation.
Thank you so much, ma'am.
I just wanted to know what time after putting the drops, after how many days or after how many hours you saw this patient and took that specular microscopy?
Ma'am, the patient presented to us after 7 days. So this was
Okay.
all day one photographs we took that day only. And
It was a
after that,
7th-day photograph.
7 day. That is the first day of presentation. The patient presented to us at 7 day, and we took the slit lamp photographs and the specular microscope on the same day.
Okay,
prior to
that's why
starting the
those
treatment.
changes.
Yes,
That's why
ma'am.
those changes in the specular macro. So
True.
otherwise, we don't expect
No,
day one changes.
yes, ma'am. Exactly. Just we wanted to document before starting any medication.
Okay,
Dr.
that
Aditi?
was
Aditi,
nice.
Yeah. Yeah,
Yeah,
ma'am.
Sunita, please.
Aditi,
Yes,
yeah,
ma'am.
yeah, okay, sir. Aditi, it was a very interesting case
Thank
presentation.
you, ma'am.
Yeah, I just wanted to ask you that you said that the patient was on this Ayurvedic medication over the counter for some reason. Now, what was the reason that she was on Ayurvedic medication? Did you highlight that? Did you
Ma'am,
get
we
it from
asked,
her?
yes, ma'am, we tried a lot, but it was told that she was having some discomfort and just for freshening her up eye. That was the exact term used to make the eyes more fresh. One of her friends had asked us to use it. It's a very commonly used medication. We all know. We
Yeah,
all
it's okay.
face
You
in.
need not name it.
Yeah,
You need
I'm
not
not
name it.
naming it.
But because tracing about the corneal edema that the
Yes,
patient
ma'am.
had developed, I wanted to understand if there
Yes,
was a
ma'am.
pre-existing disease.
Yes, ma'am.
Anyway,
We
thank you
tried
so
a
much.
couple.
It's
Thank you
nice,
so much.
interesting presentation. Yeah.
Thank you.